My pleasure.
All right. So we'll get going. So 12 months in, how are we doing on this new law?
I feel like we're doing pretty amazing. I think Maine is the first state where a major healthcare network announced on the day the law went into effect that they would be supporting patient decisions, which I think was really a godsend. And that was Maine Health. They actually implemented their policy in January. And then two other networks followed, like I think around April is when Maine General and Northern Light also implemented supportive policies. So I think, for a new state launched in our first year, it's really going well. There are still problems with patient access, I believe. And I hope as we move forward, we can figure out how to resolve that.
Is it primarily people in rural areas, northern areas that are struggling with access?
Somewhat. There's also some down in the south coastal region around York. And what I'm finding too is even within the networks that have supportive policies, from what I'm hearing, if there's a patient who's really opposed to the practice of aid in dying, they are maybe not necessarily answering patient questions about how to get access. And I think on the flip side of that, I have spoken with several patients here in Maine who are afraid to talk to their primary care physicians about this, or their oncologist, for fear that that physician may disagree with them and they, may somehow upset the apple cart of their healthcare. So it's really on both sides of this issue from a patient perspective and a physician perspective. Having that conversation is still sometimes a challenge.
Interesting. There are other resources, though. If your particular doctor, if you're afraid to bring it up, or if your particular doctor is not one who has opted into this program, you have a resource for people.
Absolutely. Maine Death with Dignity is available for healthcare providers and for patients and family members for information. Any questions they have about the law or how it works. And generally speaking, we're able to find others who we can connect practitioners and patients to in order to help them navigate their decision making.
Do you think the law needs any tweaking now that you've seen it in action? Or are you pretty happy with the way it's written?
I feel like I'm pretty happy with the way it's written. I mean, it's so new. There hasn't really been anything that has come up, I think, as an alarming thing, like, oh my God, we really need to change this because it's causing problems. So we've not encountered anything like that.
Do you have the statistics for the number of people who have used aid in dying?
I don't have them specifically. So the Maine CDC is actually the organization and the Health and Human Services that track the physician reporting, the prescriptions that have been written. And of course, they have their annual report released. I think it's around the end of March each year. So the first report actually just had the one patient who died in 2019 on it. So I imagine around March of 2021, we will get to see those new numbers. I only have an opportunity to be included if a patient or a physician contacts me at Maine Death with Dignity and they want to stay in touch with their process. Otherwise I'm not a part of the patient-physician relationship equation.
Right. I think some people were concerned there was going to be this mad rush for this. That has not happened.
Not at all. No, not at all. In fact, I'm aware of 3 deaths in the past year.
3.
3.
Yeah. Did you know Eric Carlson?
I did not.
No. He was lovely. He was just a lovely guy and very much supportive of the cause from the get-go.
I'll have to look through my emails to see if I get so many contacts, but the name's not ringing a bell. So
yeah. Well, he was in the Damascotta area and had Dr. DeMars at Mid-Coast there.
Oh, wonderful.
Yeah.
Yeah, he's Midcoast, Midcoast Parkview Palliative Care.
Yeah.
Yeah, he's a
I
guy.
have, it was interesting. So I interviewed him before he passed on Friday the 30th, and he had given me the names of all of his doctors, his therapists, everybody who was gung-ho, super supportive. He talked to all of them, gave them permission to speak. They all bailed on me. They don't want to talk about it. Does that
That's not
surprise you?
surprising. No, that is not surprising.
Why?
Well, I think, in a medical community or within the profession, of course, there's as much controversy about this within the profession as there is across the general public, right? And so I think a physician, I try to stand in those shoes and think of what it might be like to suddenly be publicly identified as the go-to doctor if you want to die when you're terminally ill, and how that might affect your practice, or how it might affect the way your colleagues look at you, or, so I sort of get that. It's difficult. The one physician I do know of who I believe did speak to the Portland Press Herald when the Ron DePrez story ran. I don't know if you had a chance to see that story. His name is Stephen Edwards. I believe he's with Martin's Point.
Okay.
And I'm pretty sure he was both mentioned in that article and may have made a statement for it. I'm not sure.
Okay, good.
But it's a great article, and read Mr. DePrez's obituary too. His daughter's a journalist, and she did a great job on that.
Oh, that's awesome.
Yeah.
Okay, that's awesome. Well, one thing that was interesting to me was one of the doctors was at Maine Med.
Yep.
I contacted her scheduler, who got back to me, said she was eager to speak with us. We scheduled a time, and then I get a call from the hospital.
Yes.
That shut it down.
Yeah.
So it's not just the providers. Do you think the hospitals themselves are a little touchy?
I think, yeah, I think it's edgy. And again, here it's new, if we were in Oregon or the state of Washington or even California, it by now is very common knowledge of where to seek the help you want. But we're into this for a year here in Maine. We're a small state with not a lot of population, so everybody knows somebody who knows somebody. And I guess I don't personally understand those kinds of decisions, because this is a topic I'm very comfortable with, and I feel like people need to have information. But I'm not protecting a big, administrative interest or a hospital network or anything like that as a, CEO or public communications specialist or anything like that. So. I think it's likely over the next 5 years we'll see a difference in that.
When you are contacted by people who want this choice, what are some of the things they say to you about why this is so important to them?
It primarily revolves around autonomy, the fact that they want to be in control in their last, moments of life. The biggest questions I get is, how does it work? How do I apply? How do I talk with my physician? From providers, I'm not hearing near as many questions around, pharmacy access, or, where do I find the physician forms or anything like that, because I think those physicians who are working on this are getting themselves pretty well schooled in the process. But mostly it's those existential things that all of us humans struggle with when we're having to face the end of our lives, and wanting to have the access. And then, there's that element of fear. I've had a couple patients who just really are afraid to talk to their primary care providers about it. And I can't elicit from them why they have that feeling that their doctors will be angry with them, or, but it's just something that they perceive.
Is there worry that this could come back around, that there could be a petition to try to repeal the law? Is that why people are hesitant to talk?
I haven't heard anything about that. And I hope there's nothing in the works. We are the first state that actually hasn't been held up by a legal action. every other state, there was an immediate lawsuit or some legal action trying to stop implementation. And that didn't happen here. I think it didn't happen in Hawaii either, but that's only 2 states that didn't face that.
How many states have death with dignity now?
9.
9.
With
Wow.
Washington, D.C. Yeah.
Wow. So you went to this conference symposium at Berkeley, I hear.
Yes.
What's your biggest takeaway from that?
Oh my goodness, it was so amazing. So it was 2 days of, ethical perspectives and hospice perspectives and clergy and, the spiritual perspective and how to support patients. And my biggest takeaway is it was so comforting for me as a non-medical person to see the level of interest and patient support and concern around this issue and delivering services. And even hearing the patient stories, it gave me so much optimism that we can help other states have this as well. Because there are people in the medical community who truly care and they truly get it, and it means something to them.
To that end, just because a medical system has kind of not necessarily signed on, but has implemented this law and made it possible within their practices, it doesn't mean that individual doctors have to sign on. They have to opt in, right?
That's correct. It is completely up to the provider's choice to participate or not participate.
And what kind of participation rate do you have?
I don't know. I haven't even seen the hospital policies yet, or the network policies.
Mm-hmm.
I think I might have read something on Maine General's website about, if you're a patient with a question about this, contact here. But I would really love to see on the providers' websites their public-facing policy, a simple statement that we do support patient decisions under the Maine Death with Dignity Act. Contact us if you need more information. But I think that's also part of that maybe reluctance to be like, the go-to people. I'm not sure.
Interesting. And the last detail of the law I just wanted to touch on is people can talk to their doctor about this. They can get the medication, but then choose never to take it.
Absolutely.
In fact, like if you investigate, you're locked in.
Right. Yeah. In fact, you can talk about this with your physician at any time. You just can't begin the formal qualification process until you're terminally ill with 6 months, prognosis. My understanding is most physicians recommend the patient not fill the prescription until they're feeling ready to use it. So they might hold on to that prescription for a while. And if, hospice and palliative support is enough and it helps them and they're comfortable with their process and they feel like they don't need it, then they just avoid the expense of having to fill the prescription, which is great.
Yeah. How much is that prescription?
I don't know specifically, but my understanding is it's somewhere around between $300 to $400.
Okay. Interesting. All right. Well, Val, was there anything else you wanted to touch on?
No, I really love what you're doing, and I can't wait to see the result of this story. And if you wouldn't mind, is it going to be aired?
It will be aired, but it'll also live online forever. So you'll always be able to find it on the website.
Great. Okay.
But I will definitely send you a little notice as to when it will air.
Oh, perfect. Good. Yeah. Thank you so much for your support, Cindy. It means all the world, really.
Of course. Happy to help, Val. Really nice talking to you, too.
You too.
Take care and keep me posted on things if you've got
other
seminars.
Yeah.
All right.
Absolutely. Great. Take care.
Talking to you. Okay. Bye, Val.